Good evening, everyone. Thank you for joining us tonight for our monthly webinar series. I'm Caitlin. I'll be moderating this evening. Here at Ortho South, I'm the patient navigator for the Spine Institute. The spine is complex, and spine care often involves multiple specialists, diagnostic tests, and different treatment options to choose from. In my role, I work closely with our spine team to ensure patients just go through their care journey well, ensuring they have a smooth and seamless experience here at Ortho South. Tonight we have with us Dr. Curlee. He is a board-certified orthopedic surgeon. He's a fellowship trained in congenital, traumatic, and degenerative spinal disorders. He believes in and is dedicated to a comprehensive patient-centered approach, integrating physical therapy, interventional physiatry, and most advanced surgical techniques such as the minimally invasive spine surgery. His primary areas of interest include disorders and conditions of the upper back and neck, which he'll be discussing this evening. Throughout the webinar, feel free to ask any questions you have in the comments, and we'll answer those at the end. While some questions may require more details about your medical history to be fully addressed, don't hesitate to ask. If more information is needed, we'll guide you on what to do next. So without further ado, I turn it over to you, Dr. Curlee.
Well, thank you very much, Caitlin, and good evening, everyone, and thanks for joining us this evening. Hope everybody's had a good day. Like I say, my name is Patrick Curlee. I'm an orthopedic surgeon here with Ortho South. I'm originally from North Carolina. I've been here in the Memphis area, though, for a little over 20 years and practicing orthopedic spine care. Like I say, I only do spine surgery and spine care, don't do any hips and knees and general orthopedics. So that's been my entire focus, my whole career. But thought we'd share something with you tonight that is an incredibly common problem out in the general population and in the world and in our lives, mine included. So we're calling it "Oh My Aching Neck." And tonight we'll go over a few things. We'll cover a lot of ground and try not to, let's see, Caitlin, my clicker, there we go. We'll cover a lot of ground tonight. We'll talk about the prevalence of neck pain. We'll give a little brief anatomy lesson, and we'll go over some common causes of neck pain, how we evaluate and treat neck pain. So, like I say, incredibly common problem. 1/2 of all individuals in our society will have a significant episode of neck pain at some point during their lifetime, significant enough that they will actually seek medical treatment for it. Neck pain is slightly more common in women than in men, and like most aches and pains of other kinds, it tends to peak in the middle ages, beginning at 40. And everybody says, oh, hit 40 and it was downhill from there. And it is just, I say, incredibly common in most people over 40 years of age. Causes of neck pain, there are a multitude of causes. We'll go over some lifestyle issues, some traumatic causes of pain, and if we have time, we may touch on some associated disease processes that commonly involve neck pain. Smoking. We all know that smoking is bad for your heart, bad for your lungs, your blood pressure, and your cardiovascular system, well documented. But smokers are actually 3 times more likely to have significant neck pain than non-smokers. And there's a multitude of reasons for this. You know, the normal aging process in the neck begins with dehydration or degeneration of the intervertebral disc. The disc are the shock absorbers between the bones in your spine. And smoking, particularly the nicotine in the cigarette or in tobacco, the nicotine constricts the little tiny small blood vessels in our body, and including those that supply blood flow and oxygen and nutrients to your spine, your spinal column, and the disc in particular. And this lack of flow of oxygen and providing nutrients to the disc accelerates this normal aging process, and in fact, exponentially accelerates that degenerative process. Obesity is another lifestyle issue. Unfortunately, you know, the rate of obesity in our country is just tremendously out of control. And obesity comes with a lot of other associated medical problems, but it also is a significant player in the cause of neck pain. It again does this in a multitude of ways, and we'll touch on each of those. So there's a growing body of evidence that being obese or being overweight causes an increase in systemic inflammation throughout our bodies. Then these biological components, these agents can cause neck pain by creating inflammation within the soft tissues of the neck, the muscles and the ligaments, and creating neck pain, which we also call myofascial neck pain, or stemming from the soft tissues. Obesity also causes an increased mechanical stress on the anatomic structures of your neck. If you're overweight and obese, basically your head is larger than normal, and that excess weight of your head creates extra stress and strain on the muscles and ligaments in your neck, and they're having to work harder just literally to hold your head up. And then over long periods of time, that increased load accelerates and again worsens the normal degenerative process in your neck and can create structural changes in the anatomy of your neck over time. We know, unfortunately, too, that obesity carries with it some psychological consequences, and not uncommonly, obese people suffer from some degree of depression or anxiety. This relationship between depression, anxiety, and pain of all kinds is well established. We know that being depressed makes you more susceptible to developing chronic pain of all sorts, including neck pain. And then it gets into this vicious cycle. Your neck hurts, and you're not able to get out and enjoy doing the things you enjoy doing, and that'll make you a little depressed. You get a little depressed. It truly makes your pain worse, and again develops this vicious cycle, which is oftentimes difficult to break. Historically, there's been certain vocations or types of occupations and recreational activities that are associated with higher incidence of neck pain. Historically, manual laborers, people that just physically work hard, in particular people that do overhead activities like sheetrock, finishers or drywall hangers, and do a lot of overhead work, had a lot of neck problems. Healthcare workers have always been at the top of the list of developing neck pain, both in the nursing profession. Nurses historically working in the hospital settings, and they have to move a lot of debilitated patients, oftentimes in awkward position, a lot of pushing and pulling. They've always had a high incidence of neck pain. As surgeons, we have a high incidence of neck pain. We spend a lot of time with our head down operating and wearing a weighted headlight and heavy magnifying glasses and things, and surgeons have a high rate of neck pain. Dentists amongst the healthcare providers have always had the highest incidence. Again, they spend a lot of time with their head down, looking in somebody's mouth, oftentimes with their head tilted awkwardly, and spend years and years in that position, and it leads to a lot of degenerative changes in neck pain. Currently, however, amongst all the occupations, office workers currently have the highest incidence of neck pain amongst all professions. And it's especially true of people who, unfortunately, the majority of people now spend a lot of time on the computer. And they spend a lot of time doing what I call doing the turtle, where you hump your shoulders over and you stick your neck out trying to get sort of a better look at your computer screen. And again, you spend hours and years in this position. It is not good for your neck. Poor posture on the computer, creates tension and stress in the muscles and ligaments of your neck. And again, this leads to chronic inflammation and pain. Ultimately, like I say, over long periods of time, it can lead to actual structural changes in the anatomy of the neck and then accelerate this degenerative process, which makes your neck hurt. Ergonomics, however, are not really the number one cause or number one contributing factor of neck pain in the work environment. Interestingly enough, it is more related to job satisfaction than actual ergonomics and the physical stress of the job. Those that have a low job satisfaction rating, in terms of they're just not happy at work, don't enjoy their work, or particularly if they have this perceived notion that the workplace environment is not healthy or their employer is not concerned about their health and well-being, those folks have a much higher incidence of mechanical and axial neck pain than the general population. Poor posture is not only a problem in the workplace. Far too many of us, unfortunately, spend way too much time on our devices. And your neck pain, well, I have more than a theory. You spend a lot of time like this, and it leads to, just like working on the computer, structural changes in your neck create stress and inflammation and pain in your neck. This is becoming increasingly problematic, unfortunately, in young people. And its current statistics show that 5 to 8-year-old kids spend an average of 3 hours a day on a mobile device. And that is way too much time and definitely not good for their necks. And more striking than that even is that in the 2-year-old and under group, they spend nearly an hour a day on a mobile device. And I know I was guilty of this when mine were small. You're somewhere and they're distracted or getting restless, and just to occupy them, you reach down and hand them your telephone to play with. And it suits the need at the time, but it is generally not good for kids to spend that much time on a device. So doing this has created basically what we describe as an overuse injury, which we used to only see in sports. You know, like if a Little League baseball player throws too many pitches and he gets some tendonitis or an injury to an elbow, or gymnast spends too much time doing back handsprings, they develop some problems in their lower back. Those are overuse injuries. And we're starting to see this in the neck, similar to what we've seen in other sports, which just sounds almost ridiculous, but it's true. In athletes and related to sports, actual sports injuries, surprisingly, we don't see much run-of-the-mill neck pain related to sports. And it's mostly because athletes are generally more physically fit and therefore less prone to degenerative and lifestyle-related neck pain. What we do see in sports, however, can be more catastrophic or more serious neck injuries like fractures and dislocations, and some of those can actually lead to spinal cord injury and paralysis. Fortunately, those numbers are still small, but it does happen every year in multitude of sports. People sustain, kids and high school players, college players, even professional athletes will sustain a catastrophic injury to their neck. Some sports more commonly than others. Football still ranks right up there along with hockey. Cheerleading. And cheerleading is no longer standing on the track at the football game with your pom-poms, saying, yay team. I mean, it involves, building pyramids and being thrown 20 feet in the air and that sort of thing. And young ladies fall from that kind of height. You can seriously injure your neck. Snow skiing has always carried a pretty high risk of neck injury, as does surfing and diving. And you can imagine if you fell, 30 feet off this wave and had hundreds of tons of water pound you into the sand beneath you, it could certainly injure your neck. Trauma, motor vehicle accidents are actually the number one cause of all traumatic neck pain. And this serves for the self-limiting, really minor episodes of neck pain, all the way down to the serious neck injuries with spinal cord injuries. The incidence of motor vehicle accidents is on the rise. And this is partly due to the increased number of vehicles on the road. I mean, the streets of Memphis have become more crowded every year, more traffic, more cars. It's, increasing the incidence of accidents. But I think it's mostly due to this, the distracted driving. I mean, it's trickled all the way down now to the crash test dummies. But, you drive down Poplar or 385 and you look in the vehicle next to you, and same thing, cell phone in one hand, a cup of coffee in the other, and they're doing everything but looking at the highway or the vehicle in front of them. And we see it all day long in my practice. I mean, every day I see several people that, hey, I was doing great till I was sitting at a red light minding my own business, and some guy ran up behind me and slammed in the rear end, not paying attention to what you're doing. I mean, it happens every day on the streets. And those generally create what we describe as a whiplash injury. And a whiplash involves where your head gets forcefully and rapidly moved back and forth. Initially, your head will fly back and hit the seat headrest behind you. Then your head will go back forward, and then oftentimes slam back one more time. So it's a back kind of movement. And this creates an injury to the soft tissues. It's basically a strain and sprain to the muscles and ligaments of your neck and shoulders. It causes neck pain that can extend into your trapezius area, the top of your shoulders, and oftentimes down between your shoulder blades. These whiplash injuries are often associated with headaches, and these headaches will typically be at the base of your skull or be what we describe as occipital headaches. Thankfully, these injuries are usually not very severe or serious, and most people do recover from these injuries with some relatively simple measures. However, I tell patients all day long that sustain these injuries, you have to really dig deep for some patience, because typically these are not sort of 3 or 4 week getting over episodes. On average, they take 3 to 4 months to recover, and sometimes even longer. But thankfully, again, most will get better with time and some relatively simple things. Degenerative disc disease. We talked about these other causes of neck pain, but by far, the number one cause of neck pain is just normal life wear and tear, what we describe as degenerative disc disease. And this happens to all of us to some degree. Some are more prone genetically to developing these problems a little sooner in life rather than later, but we all get it to some degree. And this process begins. Here's a little anatomical slide, a picture of your spinal column. It involves here, you'll have a vertebra, a bone above and a bone below. And then you have an intervertebral disc, which is basically the shock absorber in between the bones. In this bony canal behind the body, the vertebra and the disc is your spinal canal. And in that bony canal will run your spinal cord. And then at each level, there's a little bony tunnel here on each side where the nerve root will come out. And in your neck, those are the nerves that go to your shoulders and your arms. So that's a normal, what we describe as, spinal motion segment. The degenerative process begins in the disc. So the first thing that will happen, this disc will truly begin to dehydrate and dry up. And that's just part of normal aging process. And as it begins to dry up, it will begin to collapse down. And when it's not doing its shock absorber job appropriately, normally, it'll cause your neck to begin to hurt and give you this stiffness and achiness in your neck. When the disc is not doing its job, it transfers more stress and strain back here to the back part of the joint, which is called the facet joint. And these joints are just like your hips and knees or knuckles. They're lined with cartilage like the end of a chicken bone. And when we're teenagers, those joints just glide and slide almost frictionless. These joints get true arthritis, means that cartilage begins to wear out. Instead of glide and slide, they'll start grinding and rubbing like an arthritic knee. And when they do, they hurt. And then this is oftentimes people say, hey, when I turn my head, I hear this bag of gravel or this grinding, popping noise in my neck. And generally, that's what you're hearing when you feel your neck grinding, is popping in these facet joints. As this process kind of continues to develop, the disc is not just a shock absorber, it's also a ligament that holds the bones together. So when the disc is wearing out, that segment will tend to become a little unstable. Well, the easiest thing for your body to do to shore that segment up is to lay down a little rim of bone around the edge of the disc. And these are the bone spurs that everybody refers to. They hear it from their chiropractor or when they've had an x-ray, they said, oh, I was told I had bone spurs. Well, these are the spurs. They're around the edge of that disc. They're not a problem unless they get back here in the back corner near that, what we call the foramen, or that bony tunnel where the nerve root comes out. If you get a spur in that corner, it can physically begin to pinch on or impinge upon the nerve root. And pinching on that nerve root causes more intense pain, not only in your neck, but can cause some rather severe pain down your arm. People describe it oftentimes like a toothache aching down their arm. So this normal neck pain, which a lot of us experience at some point in life, usually begins just as an occasional episode of an uncomfortable stiffness in your neck, or people say, I woke up one day, I had a little crick in my neck. And as this degenerative process advances over time, these episodes can become more frequent, much more intense, and then unfortunately last a lot longer. So most commonly early on, it's just neck pain. But as that condition advances, like we showed in the little anatomical images previously, if you develop some pinching on the nerve, then that pain can begin to extend down into your arm and shoulder, and even all the way down into your hand. And in some cases, you may get numbness that can extend down your arm and hand. And in severe cases, if the nerve becomes somewhat injured from that physical pressure, you can even get weakness in the muscles of your arm that nerve root supplies. So when we refer to acute neck pain, that's pain that lasts generally less than 4 weeks. And most of these episodes will resolve spontaneously, usually without any specific treatments at all, just with relative rest and time. Most of these episodes will resolve. So when should you seek medical treatment for your neck pain? Well, generally, if your neck pain lasts more than 3 or 4 weeks, and if during that period of time, if it's getting worse instead of better, or if you develop any pain or numbness in your arm or hand, or certainly if you develop any weakness in your arms and hand, it's time to go have your neck checked out by a specialist. So treatment of this normal life, run-of-the-mill neck pain. When we first evaluate the patient, we'll do a thorough history and a physical exam. And during that exam, we'll check all your muscle groups and your strength and your sensation and your reflexes in your arms on both sides. And if you're neurologically normal, meaning that your strength is normal, your sensation in your arms and hands is normal, you don't have any red flag, abnormal reflexes or anything that we find on exam. I tell my patients this every day. I say, we'll start simple and we'll turn up the heat as we have to get you feeling better. We won't quit till we get you feeling better, but we start simple. And the simple things, and I tell patients what they can do at home, the most effective, but yet the simplest thing you can do at home is use ice. Everybody loves the heating pad. Heat's soothing and relaxing and feels good. Ice will make it better. So heat feels good. Ice will make it better. So 20 or 30 minutes on the ice pack, generally on the back of your neck or top of your shoulder, will relieve this pain and reduce the inflammation in your neck. And my staff laughs at me all day. They hear this, they can recite it in their sleep, and they'll tell you 30 minutes on the ice pack tonight will give you a better day tomorrow. And it is no exaggeration and no joke. It's just incredibly effective, cheap, simple. Everybody's got ice at home. Oftentimes people use a bag of frozen peas. You can get a fancy gel ice pack that you can put in the freezer, but you can use a bag of frozen vegetables. They'll do the same thing. Other simple things, we turn to medications, and most commonly we will use what's referred to as NSAIDs, or non-steroidal anti-inflammatory medications. Some of these are over the counter, like Advil and Aleve, and then there's prescription strength anti-inflammatories like Mobic and Celebrex. There's about 20 of them on the market, and they're all very similar, but generally very safe medications. We typically use a short course of medication, a week or 2 or 3. Sometimes people require medication long-term, and these are safe medications, even if taken long-term. With several potential side effects. Most commonly is GI upset. And people that have had any history of ulcers or gastritis or reflux have to be careful with these medications, as do people with any type of kidney dysfunction and high blood pressure. But generally speaking, very safe medications, well tolerated by most people, and really effective in treating most sort of run-of-the-mill neck pain. You can't take these medications if you're on any other type of blood thinner medication like Xarelto or Plavix or Coumadin or Eliquis or some of those. So you do have to be careful in some situations, but generally a very safe medication, very effective. We use a fair amount of steroids like prednisone and methylprednisolone, and there are several different preparations of steroids. Steroids are just super anti-inflammatory medications, very effective for relief of this type of neck pain. Steroids long-term are really terrible medications with a lot of potential serious side effects, even permanent long-term side effects. But again, in generally healthy people, a short course of steroids, and we'll generally give sort of a 5-day course of steroids that typically comes in what's referred to as a dose pack. It'll be a little blister pack where you'll take 6 pills the first, then 5, 4, 3, 2, 1. Very safe in general, very effective, and we use a lot of that. Sometimes we use medications referred to as neuromodulators like Lyrica and gabapentin, particularly if people are having arm pain. They're medications that can help sort of irritated nerves settle down, so we use a fair amount of those as well. Another simple thing, physical therapy. Very effective in eliminating the acute episodes of neck pain, very effective in teaching you some techniques and exercises and things to do that can help ward off future episodes. So again, physical therapy for range of motion and postural and strengthening exercises. They can also do some modalities such as heat and ice, ultrasound, TENS unit, and sometimes some dry needling. All these things in combination, very effective in helping people get over their episodes of neck pain. So 8 out of 10, that's the take-home number, that fortunately 80% of the people with a significant bout of neck pain will get resolution of their neck pain within a few weeks with these relatively simple measures. And then going forward, they have a 75% chance in general of leading a normal life and get back to all their normal activities and do fine. About 25% of the people will have a significant recurrent episodes in the future. And if they do, again, we start simple and turn up the heat as we have to, and can keep most people going with their normal life activities long-term with some relatively simple stuff. So turning up the heat. So if you didn't get better with ice, some medication and therapy, then we oftentimes turn to injection therapy in your neck. And there's multiple different types of injection. Generally, people think of getting a nerve block, and a nerve block is sort of a generic term for a catch-all term for spinal injections. But there are, again, different, very specific types of injections. One is an epidural steroid injection, which is into the space around the nerves. Those arthritic facet joints that we talked about on that little anatomical model, you can put injections into the joints themselves, just like if you've got a arthritic shoulder or a knee and you get a cortisone shot in your knee, where you can get injections into the facet joints. And then there's some more sophisticated therapies like radiofrequency ablation. The facet joints have little tiny nerves that go to those, and you can go on with a thermal probe and ablate or kind of zap those nerves and relieve the pain. All those injections are incredibly safe procedures, generally done under x-ray, so you know for sure you're getting the medication or the probe in just the right spot. Generally speaking, outpatient procedures that last 5 to 10 minutes, walk in, walk out thing, not too big a deal in the grand scheme of things, and overall very effective for most neck pain, with about a 75% chance of relieving or alleviating these episodes of neck pain that didn't resolve with the other measures. However, these injection therapies are usually not permanent cures, but if you get at least 3 or 4, 6 months of good relief, I mean, you can safely get 2 or 3 injections a year. And we've got many, many patients who cook along for years and years and years, get in an occasional injection and do fine. So then we have to turn up the heat some more. Say you've not responded well to injections and all the other conservative things. Then we begin to consider surgery for your neck pain. And this is the other thing I tell my patients all the time. Hey, I make my living doing spinal surgery, and yet recommend that you try and avoid it if you can. And fortunately, 8 out of 10 people, we are able to avoid surgery. But if you had debilitating pain that you decide you just really cannot live with, and you've tried basically all the other non-surgical treatments, surgery is a very reasonable thing. And overall, surgery for the cervical spine is very reliable and predictable. Generally speaking, take all comers, we have a greater than 90% success rate for most cervical surgical procedures, where people do very well and, again, get on with their life and return to normal activities. Oftentimes with the newer surgical techniques, a lot of these procedures can be performed as an outpatient procedure, come in and have surgery and go home the same day. Generally speaking, the recovery time for most cervical spinal surgery is somewhere in the neighborhood to 6 to 8 weeks, which can vary a little bit depending on the specific procedure. But fortunately also for most of them, the recovery is relatively easy, unlike a rotator cuff or a knee replacement or something that involves some pretty intensive therapy and exercises and work on your part afterwards. Most spinal surgery doesn't really require any work to recover. It's just generally time. So oftentimes we'll put you in a little collar, or a little white foam soft neck collar for maybe 3 or 4 weeks. And in the collar, you're up and about, going and doing kind of normal life stuff, fairly early right after surgery. And like I say, with generally excellent outcomes, people, greater than 90% of people really respond well to surgery. So that's kind of the skinny tonight on the run-of-the-mill neck pain. So we'll open the floor to questions and be happy to entertain any questions or comments you might have.
Yes, so we do have a few. The first one is from Miss Beverly. She says, what can I do for intense muscle pain in my neck and in my shoulder?
Muscle pain, or spasm and muscle type pain can be one of two things. It can be truly a strained, sprained muscle, okay? But oftentimes, and more commonly actually, these muscle spasms and pain in the muscle is referred pain from your spinal column, from the disc and from the pinching on the nerve, can give you that true spasm in your muscle. And that muscle pain is oftentimes referred pain, or even what we call radicular pain, coming directly from the nerve irritation in your neck. Again, what you do, Ms. Beverly, you start simple. You get on an ice pack 20 or 30 minutes every night. If you don't have any of those other contraindications to taking the ibuprofen and leave type medication, if you don't have an ulcer or a history of ulcers and not on any other blood thinners, then I would take some over-the-counter ibuprofen 2 or 3 times a day for a couple of weeks, get religious on the ice therapy on your neck. And if that doesn't get you where you need to be, you need to come see us. Be happy to take a look at your neck pain.
Perfect. We also have a question from Ms. Sheila. She asks, will neck issues cause constant pain in your shoulder blade? And is this related to sciatica area?
Another good question, Ms. Sheila. Referred pain or pain down along that inside border of your shoulder blade is incredibly common with neck problems. Again, it's a common area of referred pain, where oftentimes it's not just your pain right in your neck. The underlying problem, again, creates pain that extends not only out on top of your shoulder and outside of your arm, but very commonly down between your shoulder blades or kind of up under your shoulder, and you just feel like you can't quite work that kink out from under your shoulder blade. So that's likely, the pain in your shoulder blade is likely coming from your neck and not your shoulder, very common. Your sciatica, sciatica is, again, a general term for pain in your lower back that gets into your buttocks and back of your leg and on down your leg. Not directly related to your neck problem. However, it is most common that most people don't have either neck or low back problems. If you have shoulder blade issues and neck problems, more than likely you have degenerative disease in your lower back as well. So you've got the same process going on, but in a different area in your lower back that's causing your sciatica. So not directly related to your neck problem, though the symptoms are very similar, just in different places, but coming from different sources. Good question.
Perfect. Next one is from Miss Linda. She is asking, are there any options for chronic neck pain due to severe arthritis?
Yes, yes and no. We do not, unfortunately, in 2025 have a cure for arthritis, unfortunately. So we treat the symptoms of arthritis. And again, the degenerative changes we discussed about the disc collapsing and the bone spurs, and that's the equivalent of arthritis in your neck. So generally speaking, arthritis in your neck, little different than arthritis in your knee or your elbow, where it's just purely the joint wears out, because your neck, you got the disc and the joints and the ligaments and things. So this degenerative disease we're referring to is the equivalent of arthritis in your neck. So again, we start simple with some therapy, medications and injections. And then surgery for arthritis in your neck is effective if you have, generally speaking, kind of a limited number of levels involved in your neck. And we'll go over one more little anatomical thing in a minute, but you have 7 levels of cervical vertebra and disc in your neck. And if you've got 1 or 2, and sometimes 3 of those levels that are involved, surgery, we can basically fix your arthritic problem and get rid of your pain in your neck. Now, if you're eat up with arthritis from the base of your skull all the way down, and just every level's involved, generally not a surgical candidate, but we still try some medications and therapy injections to try to help you get along better.
Awesome. Sheila and Beverly both say thank you, and that they are going to grab their ice.
There you go. You'll be amazed. I'm telling you, it's just truly amazing.
One other question, or actually we have 2 more. The first one being, do you prefer, or do you ever tell your patients a certain type of mattress or pillow to use?
Excellent question. The answer to that is, in regards to the mattress, there is really no science behind the mattress industry. And in terms of your pain or causing your pain or relieving your pain, I recommend patients all the time, say, don't go spend thousands of dollars on a new mattress, because it's unlikely to really improve your situation. Now, if your mattress is worn out, you're not sleeping well for various reasons, that's a whole other issue. But for your neck pain, it's unlikely that an expensive mattress or a memory foam or anything is going to make any difference. There's really no science, and it's really just personal preference, firm versus soft, or pillow versus memory foam, or whatever, or feather versus memory foam. The pillow is a different story, and I meant to bring up something I could draw on. There are some cervical pillows. Yeah, if you give me a piece of paper, I'll do a crude drawing here. Is it the back one?
Yeah, there you go.
Promise I'm a better surgeon than artist, but I'm going to draw something out for you here that's the shape of a cervical pillow. So basically, this is the shape of a cervical pillow. It's got a little higher. And then you lay your noggin in this thing. As your nose, too bad. Put some eyes in. Okay, so here you are. This is the way your head rests over the hump of that cervical pillow. And again, that's a very crude drawing, but they're very effective. So again, from personal experience, I can tell you, if you have neck pain, a pillow shaped like it's just referred to as a cervical pillow can really improve your neck pain. They do take some getting used to. I'm telling you, because you first lay on that thing, it's a little different and it takes a little getting used to. And then on the downside of these things, they're generally memory foam pillow. And there are some cheap ones out there you can get for 10 or 15 or 20 bucks. And they unfortunately just will squish down flat and not really hold their shape or be effective. And I have no alliance to Tempur-Pedic brand or anything. Tempur-Pedic makes an excellent memory foam cervical pillow, but they're a little on the pricey side. Last time I bought one a long time ago was $100. I mean, I'm sure they've gone up probably in the neighborhood of $150, but a very good pillow, relieves and helps reduce your risk of episodes in the future. So if you don't want to invest in an expensive cervical pillow, generally recommend a flat pillow. And sleeping on your back is generally the best thing for your neck, is sleeping on your back with a relatively flat pillow. You can mimic this position by just rolling up a small towel and putting it behind your neck as you're laying on a flat pillow. Will mimic that position. And if you're a side sleeper, say, I can't sleep on my back, I'm a side sleeper, well, just adjust your pillow such that your head kind of stays in a neutral position. You're not all jacked up one side or the other. So the mattress, there's no science. The cervical pillow is effective, takes a little getting used to, but you have to spend some money to get it a good one.
Perfect. I think that is all of the questions that I can see. So thank you everyone for joining. Dr. Curlee, do you have any last remarks you want to make?
I do. Thank you for reminding me. I almost forgot. I got a good one. You can impress your kids next time you're at the zoo, or this is just a good cocktail party trick. Can you help reverse that slide?
Yeah.
Back up. Okay.
There's always something. Yes. Now you have control, so you should be able to back it up. You may do it.
Come across there. I just want to get off that slide. Anyway, didn't want to give it away. Okay. This is a little model of a spine and spinal column that I use when I'm explaining to patients in the office setting their problem. So generally, if you think of, average man is 6 foot tall in this country, and anatomically, human beings, we have 7 referred to as cervical vertebrae. Again, the bones of the vertebra, they're each separated by a disc, which is that shock absorber. And in the human spine, we have 7 cervical vertebrae. All right, so now we go to the next slide. So just a little quick question. We'll poll the audience here. Giraffes. Back up. Oh my goodness.
Okay, there you go.
So giraffes. Average giraffe is somewhere between 16 to 20 feet tall. Their neck is nearly half of that. So how many vertebrae do you think a giraffe has in his neck? And maybe we'll open up the floor there for just a minute and see what the estimates and guesses are on how many cervical vertebrae that a giraffe has. And think that neck's about 10 feet long in general.
Someone said 100.
That would not be an unreasonable guess for a 10-foot long neck.
Miss Sheila says 15 to 20.
15 to 20 for a 10-footer. That's also a very reasonable guess.
Getting 10, 20.
Okay. All very reasonable guesses, but let me show you something. We have at the Smithsonian Institute, a giraffe spinal column. So giraffes actually have 7 cervical vertebrae, just like humans. They're generally speaking, over a foot tall each. So they're just tremendous bones, though they have the same number of bones in their neck that we do. So you can throw that one when you're at the zoo with your kids or something, and say, and you see the giraffe, you can ask them if it's a good cocktail party trivia question too. So thanks again for joining us, and let us know if we can be of any assistance to you for your neck problems.
Yes, thank you everyone for joining. If you'd like to make an appointment with Dr. Curlee or any of our providers, we'll share that information. It's at the bottom of the screen and it will play in just a moment. We'll be back on May 15th for another webinar. So come join us then. And thank you all for staying and learning about the neck with us and Dr. Curlee.